Tom Fox back for another episode. Today, I'm absolutely thrilled to have with me Abby Filyaw and Phil Taylor. Guys, first of all, welcome and thank you so much for taking the time to visit with us today.
Thank you, Tom.
Who are you guys with?
We're with the Hill Country Council on Alcohol and Drug Abuse, but we are representing today the Hill Country Substance Use Resources Consortium.
Let's start with the Hill Country. I forgot the full.
I know. It's okay. Hill Country Substance Use Resources Consortium.
All right. Tell us what that organization is.
It is a consortium, as the name implies, of agencies, organizations that have an interest or have skin in the game when it comes to the opioid crisis, substance use disorder, recovery services, counseling. Anyone that touches any of those areas, they're a candidate to be involved in the consortium. So we have law enforcement, we have healthcare professionals, we have counselors, we have a sheriff's department, just various different, some private counseling organizations, some bigger ones. MHD is involved, just a host of different agencies.
Mm-hmm. Anyone and everyone involved with making sure that we can keep our community safe and healthy and thriving. So for any coming in with an overdose, let's say, we want to start with a place like Peterson and then create all of the bricks in the road to be sure that they don't fall through the cracks. So we want to help people from the moment that there is an overdose to long-term recovery thriving. So there's recovery homes involved, and there's agencies like ours and MHDD that can provide medication for mental health and recovery support services, and some housing places like the recovery homes so that they can get everything that they need. Naloxone, that's a big part of it. Narcan. We want to provide that to the community. So all of us come together every month to discuss how we're doing that and how we can do it better together. So
in terms of the individual who shows up at Peterson with an overdose, how do they take the step to start the road to detoxification and recovery?
great question. We have great news. Peterson allowed us to put these up in the lobby of the ER.
Show it to the
Is that
screen.
okay?
Yeah.
All right. These, they can scan the code and it will come to us at our office at the Hill Country Council. And it will also, if there's a mental health crisis, it will go straight to MHDD. And from there, then an email comes to us and we give them a call within 24 hours. So that's step one. And we just got that put in place in the ER. And that's a huge win for the consortium.
So that's a step, may even be step one, but it's only a step. How do you get that individual to the mental, physical, psychological, and spiritual help that they need to overcome an addiction?
That's something that we can't force upon someone. They have to be ready. And so the idea that we have, Tom, is to get these, we call them linkage cards, because it links the person with services they need. And so we have just saturated the community at every place that we can. They'll allow us to put these cards. We have them in English on one side and Spanish on the other. And we also have something for adults and youth. Primarily, all we serve at our facility is adults, but I know MHDD has some youth services, and there's other places that do. But so the idea is to be there so that when someone has that moment of clarity, that they're aware of us because they've seen this or they know that there's resources available. And what we've seen is that a person may be in a fog for a long time, and then they may have that split second moment of clarity, and it may not last for very long, but if they know where to turn when they reach that moment and we can connect with them, then it's possible then to move them into services. They have to be ready. It's an individual. You raise kids that kid's not going to do anything they don't want to. And so we have to motivate them, give them the tools that they need, and then hope that they'll reach out and take the help.
So you mentioned involvement with law enforcement. I'm a lawyer by professional training, so my dealing with law enforcement is generally the judicial system.
Mm-hmm.
Is the judicial system a part of this as well?
Thankfully, our office has a contract with Kirk County Adult Probation, and I get to go into the Kendall County Jail every other week to provide recovery support services within that population. I think Texas is coming out with new initiatives for deflection and diversion activities, which just means like if there's an overdose and the EMS goes, we can get people connected to services maybe before there's law enforcement involved. But when there is, there's also programs like the Phoenix program run by one of our consortium members, Dale Trees. So when they're coming out of incarceration, they can get access to life skills kind of curriculum, recovery support services, and there's an all recovery meeting portion that happens there too. So we are, yes, working with as many systems that are already in place as possible to give people as many options as they need to get some help.
You've named, Abby, several counties here in the Hill Country. Could you tell us the breadth and scope geographically of the consortium?
Kendall and Kirk counties.
And within those two, is it 50-50? Is it most of your services spent in one county or another, or is it meaningless? It's just one big geographic area.
Tom, what we've seen is that each county is unique. And for instance, the Kendall County Sheriff's Department, the jail there, they've allowed us to come in and do recovery support services there in the jail. Whereas here in Kerr County, the fire and EMS have been very open to working with us. They have these linkage cards in all of their vehicles when they go out for a call. And if it's appropriate, then they can hand them out. The fire chief, Eric Maloney, has been very open and supportive of working with us. And it just depends. And we have just different agencies. So the counties themselves are very unique in how they respond and in what ways, but we have good interaction with both counties. It's just usually different agencies.
Literally from multimillionaires and above, 100-acre ranches down to people with may not have an internet connection in their home. Does the poverty level or the income, perhaps not inequality, but disparity, does that lead to a level of addiction that you guys have to fight?
Absolutely. I think that has a big part to play in it. And thankfully, this grant that we were under allowed us to give away scholarships to recovery homes so we could at least get them started with the first month's rent or part of it so that they would be incentivized to get into a recovery home. So we've been trying to at least address the unhoused portion. We also provide free recovery support services at HCADA, the Country Council on Alcohol and Drug Abuse. So we want to be sure that anyone and everyone can come in and get services. They can at least get a recovery coach and get connected to all these other different agencies. MHDD also provides free healthcare, mental health. They have recovery coaches too. So I think hopefully a lot of the nonprofits that we work with, I know that they are, trying to break down those barriers.
For those who may not know, could you tell us what a recovery coach is?
I would love to. I am a person thriving in sustained recovery from chaotic drug and alcohol use. So I'm a person with lived experience with addiction and recovery. So I walk alongside those at any stage of their recovery journey, whether they're thinking about getting into recovery or they've been in recovery for a while, but they just need access or information about resources. So did that help?
As I mentioned, I'm a lawyer, and the state of Texas has a lawyer recovery program or a lawyer's program called TLAB. And one of the things I do is I volunteer to be I wouldn't have said a recovery coach, I would have said a sober lawyer with other lawyers who have gone through a similar process. I always saw my role as just somebody to listen and talk to. Is that different than what a recovery coach is?
It sounds pretty similar. There's the 80-20 rule. I listen 80% of the time and talk 20% of the time. We use a lot of motivational interviewing techniques like counselors do in order to help someone identify what their motivation is, capitalize on the recovery capital and strengths that they already have going for them, and continue to motivate them and encourage them to move toward health and happiness and, you know what I mean? A full and happy self-directed life.
And Tom, one of the things that Abby didn't mention that she does so well is that she is an information and resource encyclopedia. And so anybody that's in the support services, They need to be aware of what's going on in our community, what's available, and the routes to help someone get started. And so that's also a big part of what a recovery coach does is when someone comes and you find out what their needs are, that you can refer them to Salvation Army or the MHTD, or if we can't help them in-house, that we have those resources available. And Abby's very good at knowing, having her finger on the pulse of what's going on here in this county, and Kendall to a certain degree as well. So
We've talked about a lot of resources and services that start, I'm going to say, under a treatment umbrella. Do you have a similar program for prevention?
we do. We do. We have an entire division of our organization is prevention. We have prevention, we have recovery, and then some level of treatment. We do outpatient services there at the country office. And we have preventionists that go into schools, and they have I think it's a 10-week curriculum. I could be wrong about that. I believe it's a 10-week curriculum that they do with the students. And so what we'll do is work to get a letter of commitment from the school to allow us to come in, and then we'll send a preventionist in there to work with the kids for a period of time. And there's youth prevention, or YPU, which is universal. That means that's a program, and that's what we do a lot of. It's geared toward everybody, whether a child has been exposed to or experimented with or hasn't. And so it's a universal approach. And then we have also YPI, which is indicated. This child has had experience with, maybe they live in a home with someone that's using substances, or they have themselves experimented with it. So whatever they are, so we have the different prevention programs in place. And of course, they're age appropriate. We don't go into third grade and talk about the same things that we would with high schoolers. So we deal more with self-esteem and building with the younger ones to be able to say no and to make better choices, to not give in to bullying and things like that. It's very age appropriate oriented. It's also evidence-based. So everything that we do it's based on an evidence-based curriculum, which means that it has been tested and it's been proven that it produces. If you use this curriculum on 100 kids, then 30% of them will be swayed in a positive direction. I'm just pulling numbers out of the air. But so everything we do is evidence-based in the prevention side.
We've come a long way since the DARE age and the just say
Just
no
don't know.
age.
Yeah.
We're working on positive action and healthy coping skills and building resiliency. So everything we do is positively aimed and giving kids tools and coping skills.
That brings up another topic. When I was growing up, the ads were along the lines of, you've seen your friend have a bad trip, explain that to your little brother. Now the ads are, my son's dead because he took drugs that he didn't know the source of. And there was fentanyl in there and it killed him. Is that, I don't want to ask if that's a valid message, because I find it to be a valid message, but is that a message that the greater community is able to communicate? Things are very different now.
They are very different, and we have to be honest with our young people. We need to present it with a positive choice. But what I've discovered is that young people, it's not very effective to go in there and say, hey, don't do this, but just give them the information and explain that 8 out of 10 drug samples that are confiscated by law enforcement has fentanyl in it. So 8 out of 10. So you have a very high chance of coming into contact with fentanyl. It's everywhere. I say in my trainings, it's like Frank's Red Hot. They put it on everything. It's something that you must be straightforward with the kids and give them the information, because they're intelligent and they can give them the information without feeling like you're pressuring them to try to control what they're doing, but just lay it out for them and say, these are the statistics. This is what we're dealing with. This is how much fentanyl it takes to overdose, and make that clear. And so that's the effective method, or it's at least a lot more effective than just say no.
You mentioned family members, and I wanted to pick up on that a little bit and talk about the resources available for the family. Obviously, if there's a family member who's an addict, they're going to need support from their family, but the families also need support for what they've been through. Are you able to provide support for what we used to say was the family afterwards?
Absolutely. Anyone is welcome to come into the office or give us a call. You'll get them connected to some great education classes that Sakata puts on, the San Antonio Council on Alcohol and Drug Awareness. They are our parent company, and they have a great group of coaches that do an education class every couple of months about what is addiction, how to support a family member, and what language to maybe use or not use, and just educate people about the disease. I talk to family members all the time. Sometimes that's who calls me first. And I'm happy to do it because I've been there and I know what my family did for me and I know what worked and what didn't work. And so I can be honest and use my lived experience in that arena to offer support, get them connected to a live meeting somewhere in town and do whatever we can to support them and just give them all the information they would need and support. They can come in and we have counseling available too for family members and for the people suffering with the disease. So, yes, we cover the family.
Is there anything more about the consortium that you wanted to talk about that I haven't asked about?
One thing that comes to mind that one of my uh, important pieces that I want to make sure is in place with our consortium is that when someone does come within reach of one of our consortium member agencies, that person, if that agency can't help them, that they know that they have the resources, they have the connections in place, so the relationships in place that they can hand that person off to someone that can help them. Um, and so that's one of the things that we try to do in the consortium is make sure that we don't let anybody fall through the cracks. We're really big on trying to respond promptly when we get a response on one of these linkage cards. And we work closely. One of the agencies that we probably work the closest with would be MHDD. And so we refer back and forth. And I can't stress how important it is to have those human relationships. Just a piece of paper, that a letter of commitment or an MOU, it doesn't mean much if you don't have that relationship with those individuals between the two agencies. And so we have some good relationships like that, and it's very helpful, and it's a personal thing. And we, because nobody's in this line of work because they want to make a lot of money. So if somebody's doing this, they have a heart for it. They have a heart for people. And so we strive to make sure that nobody falls through the gaps. And so I'd say that's a big piece of what our consortium is about. Of course, we're also collecting data so that we know what's going on, and all those other things that we do. But it's that human element that's what makes us get up and come to work every morning. Are those people that actually need the services so desperately bad?
We're getting naloxone into the community also. We have access to quite a bit because of the grant. It's given to us. And we get it out into the community. And Phil has done an amazing job of doing a lot of naloxone presentations, training on how to recognize an opioid overdose and how to administer the naloxone to the person who is suffering the overdose. And we have another community partner that does those presentations also. And I think his most powerful presentation, though, is his stigma awareness and reduction training, because substance use disorder is the number one most stigmatized medical condition in America. And the more we talk about it, the more aware we can become. And maybe the more help people will feel safe getting, because we can normalize recovery and just take the stigma piece out. It's not a moral failing, it's just a brain disease, a chronic brain disease. So I really appreciate him getting out into the community, and he'll do them for anyone, truly, any agency. I know that some local places in town are required now to have Narcan, naloxone on hand. Any kind of public drinkery, I guess you could call it, a bar. They have to have that stuff on hand now. And high schools are now requiring fentanyl awareness
There
training.
was a state law that went into effect back last year sometime. And so now all of the schools are required to do fentanyl awareness training with their kids. And so, matter of fact, Sakata has been instrumental in helping train several of the schools here in San Antonio and here as well in the Hill Country area as well.
We want to combat stigma with knowledge. And so that's a big part of what the consortium does too. We just get together on how best to serve the community. We have these naloxone distribution newspaper stands. We'll call them like naloxone vending machines. So we can put those out. We're looking at locations actually, if anyone in the community would like to host one of these. We want to give it out. We want to put it in a public place where anyone can just go and get it. They won't have to talk to anyone. They won't have to be asked questions. It's just let's save a life and make it as accessible as possible to prevent as many overdoses as we can.
It has to be in a climate controlled area. So it's kind of a unique situation. It can't just be left outside, but it needs to be accessible to anyone. It also needs to be in a place where someone would feel comfortable coming and getting the product. But as Abby mentioned, they're the ones that we have four different methods or ways of, we have the newspaper stand style, and it just has a spring loaded door. You pull it open and the product's inside. You just reach out, take one or two or whatever you need. And then we actually have a little small suitcase looking units that attach to the wall, and open them up and take one out like that. And we actually even have little cardboard printers that would sit on like a shelf or a counter, or someone can just come up and take one. So we're working to get those in good locations in the community so that it is accessible to anyone that needs it, and then trying to make people aware that it's there.
Just like a first aid kit.
Good idea to keep naloxone with your first aid kit.
And unfortunately, we're near the end of our time for this episode. But before we leave, I wanted to ask if our listeners wanted any more information on our topics today, or to get in touch with you guys, what would be the best way for them to do, or the best place for them to go?
If they can get their hands on one of these, they can scan the QR code. If not, they can call our office directly. And I'm terrible at memorizing numbers, so I've been there for a while, but I still don't have it memorized. But our main line at the office at the Hill Country Council is 830-367-4667. And they can just make that phone call, and our office manager will get them directed towards someone that can help them.
HCADA.org, acada.org is a good place to start. Also, I think there's a link to Say Hello on the website, and we have a Facebook page, and we definitely have a LinkedIn and an X, I believe. So social media too.
Well, guys, thanks so much for taking the time to visit with me, and we definitely will continue this conversation.
Thank you, Tom.
Thank you, Tom.
Glad to be here.